Thank you, Mr. Chairman. And before I begin my questioning, I'd like to submit for the record an article entitled, "Will America's Fragmented Public Health System Meet the Ebola Challenge?" by Mark Rothstein, who's the director of the Institute of Bioethics at the University of Louisville Medical School. I'd like to submit that for the record. Thank you. I'd like to thank the panel for their testimony and answering the questions. And this has been a very enlightening hearing. I also want to acknowledge at the beginning that the Kentucky Air National Guard, which is based in my district, is in Senegal right now providing the infrastructure for the 101st. So in their efforts, I want to acknowledge their participation in this effort. At the risk of displaying my ignorance, we apparently know that you cannot detect the Ebola until the same time it becomes symptomatic, when it becomes contagious. Is there any other kind of test that would indicate whether anything's going on in the body? I know that sometimes my doctor will say, well, you've got an elevated white blood cell count, something's going on there. It may not know exactly what it is. Is that true of the Ebola, or would that not indicate that something's going on?
At this point, we don't have a test that would identify it before someone has symptoms. In fact, the test only turns positive when they're sick, and the test is for the virus itself. And that's another reason, besides the patterns of disease, that we're confident that it doesn't spread. We can't even find tiny amounts of it in people's body until they get sick.
Is there any research being done as to a possible test, earlier test for this?
There's a lot of research being done to try to understand and diagnose and treat and prevent better.
Good. I am a media person by background. That's where I spent most of my career, so I'm very sensitive to how the media treat situations like this. And certainly the media can be a very important part of providing public information about a potential threat to public safety as this is. But they can also go overboard, as we know. And I'm curious because I see every day comments in the media about the spread of Ebola and outbreaks of Ebola. And while, yes, technically it has spread from one person to two healthcare workers, I know that the public may hear that very differently and perceive there to be a much broader and widespread incident of Ebola in the country. And I see things like, for instance, in the Washington Post today, the picture of the woman at Dulles Airport who looks like she's mummified because of her concern of contracting Ebola. So, and I know that now one survey showed 98% of the American people are aware of the Ebola situation, and not even 50% know there's an election coming up in 3 weeks. So the media has certainly let the public know that there's something going on. My question to you is, has the media coverage so far been helpful or harmful in your efforts to have the public have an appropriate concern and awareness of what the situation is?
Well, anytime healthcare workers become infected and ill in this country, it's unacceptable, and our thoughts are with the two infected healthcare workers and hoping for their recovery. So it's certainly understandable that there's intense media interest. It's new to the United States. It's a scary disease. Had a movie made about it. And it's important to have that attention so that we as a society pay attention, and doctors in hospitals and community health clinics and primary care practices think of the possibility of Ebola, that we generate the societal will and resources to both protect Americans and stop it at the source, because it's got to be stopped at the source to make us completely safe. Some of the coverage, I think many would agree, may exaggerate the potential risks or may confuse people about the risks. There really is a lot we know about Ebola. CDC has an entire group of professionals who spend their careers working on Ebola and other similar infections. They go out and stop outbreaks all the time. We have stopped every outbreak of Ebola until the current one in West Africa. There's zero doubt in my mind that barring a mutation which changes it, which we don't think is likely, there will not be a large outbreak in the U.S. So I think we welcome the attention. It'd be important at times to put it in perspective.
I appreciate that. I agree totally. One final question in the last 30 seconds. Is there any additional authority that CDC would more helpful in conducting or meeting your responsibilities? I know most of yours is guidance and information, but is there any specific authority that Congress could grant you that would make your job, would make it easier for you to do your job?
We're looking at a variety of things, emergency procurement, for example, to see in conjunction with the administration whether there are some changes that might allow us to respond more quickly and effectively.
Okay. Thank you. I yield back.
Recognize Mr.